So, since the fast is during the whole day, how do we monitor the glucose?
Yeah. So in general, for diabetic patients, we ask them to check their glucose like fasting and the ppbs, means before breakfast and 2 hours after breakfast. But during the fast, some people they don't like to check their sugar during the fast, during the daytime. So what they can do is just before the sunrise, just before their heavy meal, they can check their sugar. That will be the fasting. And if they can check 2 hours after the meal, it will be the PPBS, the postprandial sugar. And in the evening, like at iftar, just before the meal, they can check their sugar. That will be fasting because 8 hours they are taking the fast. And just after the iftar meal, 2 hours after the iftar meal, again they can check their sugar. So that can be the postprandial blood sugar. Generally, we advise to have check sugar at least 6 to 7 times a day, which is ideal. But most of the patients they won't like to check 6 7 times unless and until it is very emergency. So at least they can check 2 or 3 times a day, like the I said, at the iftar before and after the meal, and at night once. And if there is any suppose hypoglycemia, sugar is too low, less than 70, then immediately they should have some glucose or sugar or some candy. And if it is very severe hypo, very low sugar, then they should try to reach a nearby hospital as early as possible to get the IV dextrose saline. And if the sugars are too high, suppose more than 250, 300, then again they should try to consult their doctor immediately to change the dose of the medicine whichever they are taking.